The question is, how did I gain confidence when it comes to standing up for yourself to the residents and doctors? So I had a very different experience, like growing up in nursing, I guess you could say. Starting in liver transplant, it just is run very differently. For example, we did not have any residents, so all of the intermediate care was handled by the nurse practitioner or the PAs. That's who I personally would go to for orders. And during nightly rounding, it would be the attending, the NP or PA on the case, and then the pharmacist. And the nurse would actually be responsible for presenting the patient to the team. And when I say presenting the patient, I just mean, giving report, essentially, like what the patient did today, neuro status, cardiovascular, respiratory, GIGU, all those things. And I think because I was able to start off doing that, I was just able to get comfortable with talking to people in other positions and really presenting my case. Like, okay, this is what I'm telling you. I think the patient needs this. Rounds is the perfect time to discuss that with the attending. But then when I moved to float pool ICU and I started getting trained and seeing how all these other ICUs worked, I realized that TI is very different, and it's typically the resident who's presenting the patient, not the nurse. And I think just because of my prior experience, I was able to see the difference between like intern or a year 1 or year 2 residents compared to an NP and PA that has been working in the field for 5-6+ years. And I was already comfortable in my skills and comfortable in my knowledge. So when it was time for me to leave and it was time for me to ask these new residents for orders, I knew what I was talking about. I had the confidence in myself that I know what I'm talking about. And it's this dude's first day in the hospital. So I don't know, just recognizing that residents and doctors are people too, I think that just helps.